Joe, why? Can anybody answer me? Why is that if it's a C2, oh, she got kicked out. Why is that if it's a C2, we always put do not drive or operate heavy machinery when on this medication? My Shauna, what does it cause? What does it cause?
To make you drowsy?
It usually makes you sleepy or drowsy. The C2s usually make you sleepy or drowsy, or it helps you fall asleep as well. Okay, so this is why we have, and it has so many effects in the nervous system and the central nervous system. Okay, some effects are even hallucination, paranoia, and stuff like that. Okay, so we don't want, in general, C2s should have a warning: do not drive or operate heavy machineries, and highly addictive. Remember, C1 are your street drugs. Let's do a review real quick. Okay, C1 are your street drugs. Okay, no approved therapeutic effect. I'd like to put an asterisk on the marijuana part. Don't debate this with me. I told you the answer to that. Each state has a different rule when it comes to marijuana, but federally, marijuana is still categorized as C1. Okay, another hint, hint, wink, wink for your national certification exam. When state and federal laws differ, which one do you follow? James, do you remember? When state and federal law differ, which one do you follow?
Isn't it state?
Elizabeth. When state or federal law differ, which one do you follow?
You follow the one that's more
correct. Whichever one is more stringent. You know, that comes out on the board exam verbatim. Whichever one is more stringent. If the state is stricter than the federal rule, then we follow the state rule. If the federal rule is stricter than the state, then we follow. Did I just say the same thing? Again. If the state is stricter than the federal laws, then we follow the state rules, okay, or laws. If the federal is stricter than the state, then we follow the federal laws, okay? Whichever one is more stringent. Another one that you can have a correct answer on the board exam and on your law test, okay? Because after week 3, we're gonna do pharmacy law, okay? So whichever one is more stringent. And just so you know, marijuana is still federally classified under C1. So C1 is more addictive than C2. C2 is more addictive than C3. C3 is more addictive than C4. C4 is more addictive than C5. Okay, remember, C1, no approved therapeutic effect. Okay, those are your street drugs. Okay, crack cocaine is a C1. However, when it becomes just cocaine, it becomes a C2. It's an anesthetic still in the hospitals. Okay, remember that difference alone. Crack cocaine is C1. Cocaine is C2. Okay, C2s and C3s are opioids. Now, combination opioids are C2. In the past, there were some C3s. So C2s and C3s are used for what? Pain. Moderate to severe pain. I mentioned this. C3s, C4s, and C5s. What's the acronym that I'd like to remember? When I'm talking about C3s, C4s, and C5s, the acronym SAD. And what does SAD stand for? My Shauna, do you remember what SAD stand for?
Sleep, anxiety, and depression.
Correct. Sleep, anxiety, and depression. Okay. Another information that I'd like you to remember. C2, how many refills? Jason?
No refills.
No refill. Always a brand new prescription, must be ink signed by the prescriber, ink signed in black by the prescriber. How long is the prescription good for a C2, Elizabeth?
14 days.
Correct. Good job. Okay. C2 has special instructions. Remember those. Okay. C3, C4, and C5. How many refills? Christine. Christine, how many refills for C3s, C4s, and C5s?
6.
We don't count the initial fill. I'm just asking how many refills. It's 5 refills, but it's good for 6 months. Remember that? 5 refills, but it's good for 6 months. I'm talking refills. So there's an initial fill, and then there's 5 refills. That's why C3, C4, C5 prescriptions last for 6 months. Okay? C2, only 14 days. What if it's a non-controlled, but it's prescription medication? Elizabeth, how long is the prescription good for?
12 months.
12 months. How many refills are allowed?
I believe it's 6 because you have to see the doctor after 6 months in order to get it.
If it's good for 12 months, then 12 refills are allowed. That's why I said it's a total of 13 because there's an initial fill and then 12 refills. That last month allows you to schedule for your wellness exam. Gives you a 1-month buffer, okay? But the refills allowed for prescription medications that are not controlled is 12. Correct, Shauna. 12 refills, okay? You gotta remember that. Okay, good job. You remember the wellness exam once a year. The insurance pays for once a year. Okay, wellness exam. So there's a total of 13, okay? That extra 1 month that you have is for you to be able to schedule your doctor's appointment or your wellness exam so you're not getting shorted. And what are those prescriptions? Those are your maintenance drug, maintenance for your heart, maintenance for your GERD, maintenance for everything, for asthma, okay? Some doctors, of course, they'd like to see you after 6 months, or when they give you a new prescription, they'd like to ask feedback from you, how you're doing with your new prescription within 2 months. Okay, but if we're just talking about a wellness exam, it's once a year. Okay, so for maintenance drugs, patients have been taking this for years and years and years. They know that it works for them. They know the side effects. They've accepted those side effects, or it has very minimal side effects on them. Then the wellness exam usually is just once a year. That's why there's 12 refills allowed on prescription or maintenance drug. What about over the counter? Okay, what about over the counter? Jason, what about over the counter? Do we need prescription for over the counter drugs?
You don't need a prescription, but you can get OTC medications written as prescription. Sometimes doctors do it so insurance covers it.
Very, very good point. Okay, over the counter drugs, you usually don't need a prescription. That's why it's called over the counter. It is based on the discretion of the patient or the consumer. Okay, that's why they're over the counter. You can just grab it from shelves by yourself. Okay, however, Jason made an important point that over the counter medications can be part of your prescription, especially if you have a very good insurance. You might want to ask your doctor to write it, okay, as a prescription. Why? Versus paying for a bottle that costs you $15, your insurance might be very good that you only have to pay $5 copay or none. So might as well, okay, request your prescriber to write that as a prescription, okay? Like your allergy meds, okay? Most of the time we'll make that decision. Oh, you know what? I'm gonna grab Allegra or I'm gonna grab Zyrtec over the counter, right? And each small bottle is about, depending on the brand, if it's generic, it's probably between $8 to $15. But if you have a year-round allergy, your insurance may pay for that. And your doctor can actually prescribe you Zyrtec or Allegra or whatever allergy medication, okay? And if it's written on your, it's written on a prescription, the insurance may cover it and there's nothing that you need to pay, okay?